Okay, hello everyone, and welcome to our discussion on transitional justice, atrocity prevention, and COVID-19, presented by Global Action Against Mass Atrocity Crimes, or GAMAC, and the Global Initiative for Justice, Truth, and Reconciliation, which is a flagship program of the International Coalition of Sites of Conscience. My name is Sarah Bradshaw, and I'm a program director for the GIJTR, and I'll be moderating today's discussion. For those of you who may be unfamiliar with our work, the International Coalition of Sites of Conscience, or ICSC, is the only global network of over 275 museums, historic sites, and memory initiatives in 65 countries dedicated to connecting past struggles to today's human rights movements. ICSC connects and builds the capacity of these vital sites of conscience through grants, networking, training, and advocacy. GAMAC, or Global Action Against Mass Atrocity Crimes, is a global, inclusive, state-led initiative composed of states, civil society, and academic institutions that pledge to prevent atrocities by establishing national prevention architectures and policies. As a platform, GAMAC convenes its diverse community in person and online to openly share good practices, expertise, and experiences without pointing fingers, and to look instead for concrete and feasible solutions. Since 2013, GAMAC has organized global meetings every 2 years, and GAMAC 4, its next meeting, will take place in 2021 and will address hate speech, incitement, and discrimination. Finally, as this webinar is presented through the GIJTR, the Global Initiative for Justice, Truth, and Reconciliation is a consortium of 9 international organizations led by ICSC, who together offer holistic, innovative, and multidisciplinary approaches to issues of truth, justice, and reconciliation. We work primarily with local populations, civil society organizations, survivors, and governments to develop transitional justice approaches that are victim-centered and collaborative, and that support dignity, respect, inclusion, and transparency in societies emerging from conflict or periods of authoritarian rule. Since our founding in 2014, GIJTR has engaged with people from 46 countries, worked with over 500 CSOs, supported the development and implementation of over 150 community-driven projects, as well as the collection of more than 5,000 survivor testimonies of human rights violations. Before we begin, I'd like to mention that although attendees won't be able to see each other throughout this 1-hour webinar, you can still engage with each other as well as with the panelists by leaving comments and questions through the chat box at any time. Towards the end of this webinar, there will be a Q&A session during which we will do our best to answer questions that you've shared. At that time, you can also use the raise your hand feature and we will unmute you should you wish to speak. So today we're here to reflect on the specific challenges that the COVID-19 pandemic has posed for atrocity prevention and transitional justice efforts around the world. COVID-19 has dramatically affected, in almost entirely negative ways, many facets of life in every region of the world, from economic stability to physical and emotional well-being. Largely included in this trend are transitional justice efforts in a variety of contexts. Not only have the processes themselves been curtailed in some countries, but reports of human rights violations during the pandemic have added new dimensions to ongoing procedures. Truth commissions, prosecutions, and other formal transitional justice mechanisms have had to adapt their operations in the face of new public health restrictions, and community-led efforts have shifted their work to meet survivors' urgent needs while also ensuring that their struggles for truth and justice are not forgotten. Despite these impacts, the universal nature of the pandemic has had at least one positive effect. On March 23rd, the UN Secretary General called for a global ceasefire, saying it is time to put armed conflict on lockdown and focus together on the true fight of our lives. A ceasefire would allow societies to focus their resources on addressing the coronavirus pandemic and would facilitate humanitarian workers' access to the most vulnerable populations affected by violence. Since then, parties to conflicts in at least 11 countries committed to a cessation of hostilities during the pandemic, and yet violent conflict continues in parts of Yemen, Libya, Syria, Afghanistan, and Burkina Faso, among other places. Even in the societies experiencing a temporary ceasefire, next steps will be critical, both for ensuring that an absence of hostilities actually leads to a durable peace, and that efforts to fight the virus do not further marginalize survivors and other vulnerable populations. We're looking forward to discussing these issues more in depth over the next hour. And with that, I'm so pleased to welcome our 4 fantastic panelists here to discuss these issues in more depth with us today. First, we welcome Leonor Arteaga Rubio, who heads the program on impunity and grave human rights violations at the Due Process of Law Foundation, or DPLF, in Washington, D.C. DPLF is also a consortium partner in the GIJTR. In February 2018, Leonor was appointed by the El Salvador government as a commissioner for the National Commission for the Search of Disappeared Persons, or CANA Búsqueda, in the context of El Salvador's armed conflict, an ad honorem position. At DPLF, Leonor leads research, advocacy, and monitoring initiatives on truth and justice issues related to past armed conflicts and current state violence in Latin America. She has also served as Deputy Ombudsman for Children and Youth at the Ombudsman's Office in El Salvador, as well as worked with different human rights organizations and victims groups on litigation, both at the national and international levels. Next, we're very excited to welcome Mo Bleeker, Special Envoy for dealing with the past and prevention of atrocities at the Swiss Federal Department of Foreign Affairs, or FDFA. Mo Bleeker has worked for the FDFA since 2003 and has accompanied complex political transition processes in numerous contexts and continents, such as Central America, Colombia, the Balkans, South, Southeast, and Central Asia, as well as several regions in Africa. Between 2009 and 2018, she acted as president of the International Advisory Board of the National Historical Memory Commission in Colombia, and currently serves as Special Envoy for Peace in Colombia. Between 2015 and 2019, she acted as chair of the Transitional Justice and Reconciliation Commission, or TJRC, of the Peace Agreement on the Bangsamoro in Philippines, and acts now as advisor to both peace panels. Since 2013, she has chaired the international prevention platform GANAC. Mo Bleeker graduated in anthropology, religion sciences, journalism, and social communication, and holds a postgraduate diploma in development studies from the Graduate Institute of International and Development Studies in Geneva. Next, I'd like to welcome Anjali, or Anji Manavanan, who is the Director of Programs at the World Federalist Movement Institute for Global Policy, where she manages all programming, including the Coalition for the International Criminal Court and the International Coalition for the Responsibility to Protect Programs. As a human rights lawyer, she has expertise in atrocity crimes, transitional justice, gender, and freedom of expression. Prior to joining WFM-IGP, Anji worked at local organizations in India, Palestine, and West Africa, and as a transitional justice consultant. She has published on a range of human rights topics, including international justice, genocide, recognition, sexual and gender-based violence, and freedom of expression. She holds a JD from New York University School of Law and a BS in physics from the University of Virginia. Finally, I'd like to welcome Anyango Owor, who is Vice Chair of Justice Access Point, a one-stop justice center of excellence enabling citizens and citizen organizations in fragile and post-conflict communities in Uganda to effectively and efficiently access and utilize the available justice mechanisms and meet their justice needs. Anyango is also the managing partner of Anyango & Company, where he has advised clients for over 12 years in both public and private transactions. He has extensive experience handling public interest cases before the Constitutional Court. As part of his passion for legislative reform, rule of law, and development of the legal practice in Uganda, Anyango has served on committees of the Uganda Law Society. He has been a visiting lecturer of law at the University of Pretoria, South Africa. He regularly serves as a part-time lecturer of law, and he is a member of the Commonwealth Lawyers Association, the East African Law Society, an advocate of the courts of Uganda, and a commissioner for oaths. Thank you again to all of our panelists for joining us today for this conversation. So with that, I wanted to pose the first question to all 4 of you. Based on your context, could you each please tell us about an example in which states have already used COVID as justification for suppressing human rights and or aggravating existing risk factors for atrocities? What new challenges has this pandemic presented for transitional justice efforts in your context, if applicable? So we'll start with Mo. Oh, Mo, I think you might be muted.
Apologies. Thank you very much. And first, I would like to warmly thank Sites of Conscience for this initiative, and also, of course, the GAMAC Support Office. Prevention and dealing with the legacy of the past atrocities are intimately linked, and this conversation is very timely. So thank you really very much. I'm also very honored to meet my companion guest experts. I'm very excited to have this conversation with you, and humbled also by your wealth of experience. To answer the first question, to begin with, I would like first to take a little bit distance and underline that this pandemic actually has shed a limelight on existing vulnerabilities of all our societies. That's very important to note. Indeed, if we don't act timely now, and if we don't take this seriously, these very same vulnerabilities might become risk factors, or they might be corrected, hopefully, if we can have dialogue in our societies about that, and transform to become actually resilient factors tomorrow. So I think it's very important to address these vulnerabilities. As chair of GAMAC, I'm particularly sensitive also to this notion of vulnerability. Every country has vulnerability, and therefore no country is immune. So we are all potentially at risk. And in this context, it's very critical to identify and acknowledge in each of our societies the negative impact that the pandemic has had. This is very critical. I would like to give you some examples stemming from Europe, and I understand that in the second round of conversation, we'll have examples tied more strictly to transitional justice or to prevention. I want to share some examples of authoritarian, abusive, and other worrisome trends signalized in Europe during this COVID pandemic. So hate speech and several forms of discrimination have been observed in several countries. Remember that tomorrow, if we do nothing for this might become subject matters for transitional justice activities, so we really want to prevent them. So I can signalize several elements. For example, exclusion of patients from certain disease, for example, AIDS, have been excluded from hospitals. Exclusion of national minorities or discrimination and hate speech, as it Roms, for example, or illegal migrants. In other contexts, prisoners have been massively released from jail to the exclusion, often, of government opponents imprisoned on terrorism charges, many of them without judgment. And it has put sick prisoners, what I would call political prisoners, most of all, at grave risk. In several countries also, some governments have intended to pass legislation to curb freedom of media, impose limits on fundamental rights, or abuse so-called emergency laws. Some governments also have used, or even abused, policy of decrees, the use of decrees, and tried to prevent the legislative to play its role. So if these tendencies remain not addressed, there are many risks that this may in turn lead to atrocities in the future and may hamper work realized also today in transitional justice. I want to underline this because transitional justice is not only something that we do to deal with past crimes. Actually, transitional justice is a bridge to strengthen the capacity of a state to take its responsibility and the capacity of the state to answer to the needs of the victim. So I just wanted to begin with this. I just hope this is contributing to the conversation, and I go back to you. Thank you.
Thank you so much, Mo. And thank you for highlighting the universality of the risks that the pandemic poses, of course, not just for public health, but for risk factors for atrocities. So thank you. So next I'll pose the same question to Leonor. Leonor?
Thank you, Sarah. Thanks to CITES for organizing this event, which is timely important. And it's also an honor for me to share this panel with all these experts. I mean, the COVID-19 crisis has already shown that we are facing more than just a medical emergency. Right? This situation, this pandemic is bringing to the surface problems that are rooted in historical inequality, exclusion, and injustice. In the case of Latin America, and there are been many voices showing concerns about governments taking actions that are going through or that are contributing to trends of militarization, populism, and basically anti-democratic measures. And what we need in this pandemic is that governments, while acting promptly and decisively on health issues, should also protect key values like democracy and human rights. El Salvador has become a negative example in the Latin America context of a government that is using this pandemic to concentrate power in the executive branch and launching several measures that are anti-democratic and are authoritarian, and which now are the country is in danger to repeating some of the underlying causes of the armed conflict that the country went through 25, 30 years ago. So the current president, President Nayib Bukele, from the beginning of this pandemic, has sent like worrying signals that have set of alarms across broad sectors on El Salvador and in the international community. These signals range from issuing important executive orders via Twitter and that are against the constitution, using the military to threaten the country's legislative body, disregarding judicial rulings, including Supreme Court rulings, and basically attacking those who he considers his political adversaries, including human rights defenders. So now in El Salvador, at least 16,000 people have been detained by the government and put in containment centers for violating curfew orders, which has already been declared unconstitutional by the Supreme Court. And also what we're seeing in this country is that during the pandemic, militarization of police has increased, and also the use of police for political purposes. And also gender violence has been increasing, even though the government is denying it. So through this pandemic, that is an unprecedented situation around the world, the lessons that we've drawn from transitional justice experiences from the past in El Salvador and in Latin America are very clear. As a society, we cannot wait until the pandemic passes to investigate challenges to human rights, to raise questions, and to hold governments accountable. Otherwise, we could see like the return of authoritarian regime that made so much harm to El Salvador and to Latin America in general. Thank you.
Thank you, Leonor. And thank you for calling attention to the fact that in most cases, COVID is not actually introducing new issues, but it's accentuating and laying bare issues that were already there. I think this will be important, especially later when we discuss lessons learned for future. So next I want to ask Anyango the same question. Anyango?
Hello there, and thank you for organizing this very timely conversation. So in Uganda, like many other African countries, COVID has been an excuse for governments to concentrate power in the arms of the executive as well, and also for military strongmen to concentrate power into their individual hands. Therefore, it is no surprise that there have been a number of human rights violations, and like my colleagues have already said, this only serves to show the iniquities, the injustice, and the other human rights violations that already existed. So COVID has, in a way, shone a light in some of the dark spots that already existed. In Uganda, for example, we saw an increase in police brutality. Of course, police brutality has been an issue around the world, but in Uganda during this particular period, we've seen both police and the military really violate people's rights. We've also seen also violation of the several media freedoms. Again, this is linked to some of the violations and atrocities that have taken place, where police prevents journalists from covering certain stories, especially those outside the capital. We have also seen a very alarming rate of violation of the right to counsel. So many of the persons who were arrested for violating COVID rules and regulations and laws were arrested, and they couldn't access their lawyers because, of course, lawyers were considered to be non-essential staff or personnel in the fight against COVID. So, so we have a number of people who were arrested and incarcerated and couldn't access legal services. The right to health as well has been impacted on a very wide scale because governments around Africa concentrated all their efforts and resources to fighting a single disease to the detriment of other health issues. Of course, the health systems were, as we all know, so still very fragile. But we had emergencies like women going to give birth who did not have transport to go to health centers, and a number of deaths actually occurring because of this, because public transport was actually banned. In Uganda, for example, only 7% of the population arrives in an ambulance at the hospital. So without essential transport, then we had a number of fatalities. This, of course, affecting the right to health and the right to life.
Thank you, Anyango, and thank you for tying this into how the pandemic has impacted economic, social, and cultural rights and everyone's access to those. Finally, we'll turn to Anji with the same question.
First, thank you, CITES and GAMAC for the opportunity to speak alongside these esteemed panelists. Focusing on West Africa, I would like to share not only challenges facing transitional justice and atrocity prevention, but first some positive developments in the fight against COVID-19 so far. The management of COVID in Africa has been fairly promising so far, with cases on the continent remaining lower than in some parts of the world. And this is partly due to Africa's experience in dealing with epidemics at various points in time. For example, the AU COVID-19 Response Fund is mobilizing financial resources, and there are innovative approaches to testing COVID and producing PPE and ventilators in countries like Senegal, which have shown that African countries can be resourceful and adept in handling the pandemic despite their weak health systems. But of course, Africa cannot afford to be complacent. It needs a sustained, continuous fight to defeat COVID. The continent hosts communities at risk of socioeconomic vulnerability and conflict-induced displacement, and there's often limited access to health services. To focus on the fight against COVID in anticipation of challenges to human rights and also to peace and security, the chairperson of the AU Commission called for a ceasefire in all conflicts in Africa, echoing the call by the UN Secretary General, and parties to the conflict in Cameroon, CAR, Libya, South Sudan, and Sudan, for example, have answered this call. On transitional justice, last year, Africa adopted its first continental framework on transitional justice, the AU Transitional Justice Policy. 2020 should have been an opportunity for the implementation of this policy and seeing its contribution to dealing with atrocities throughout the different countries on the continent. But unfortunately, the pandemic has diverted the attention of regional multilateral organizations and governments from this pursuit. In fact, in several countries, the pandemic and the measures put in place to contain the coronavirus have effectively halted ongoing transitional justice processes. The government of the Gambia, for example, was working with the AU, ECOWAS, and the UN on transitional justice, including security sector reform and constitutional reform. But following COVID and the pandemic, the Truth, Reconciliation, and Reparations Commission suspended its public hearings and outreach activities from March 18th until the end of June. Preventative measures against COVID have also been used to suppress human rights. This has been the case in, for example, Ethiopia, Kenya, Liberia, Nigeria, and Zimbabwe, and Uganda, as just mentioned right now before my presentation. And I'll give some more specific examples. In Nigeria, security forces committed at least 21 unlawful killings, as well as physical assaults and intimidation of journalists during the lockdown since March 29th. Security forces have used excessive force, resulting in death. They've used torture and arbitrary arrests and detentions to enforce the curfew. In Liberia, there have been violations and missteps in the enforcement of the state of emergency, including killings and abuses by security forces. And the authorities in Guinea have harassed, intimidated, and arbitrarily arrested opposition members and proponents in recent weeks in an atmosphere of insecurity linked to restrictions because of the pandemic. And these restrictions followed the state of emergency and other preventative measures since March 27th. The mishandling of the pandemic as a guise for committing human rights violations is perhaps more unfortunate in Liberia and Guinea, as well as in Sierra Leone, all of which experienced a similar situation during the Ebola crisis of 2014 and 2015. But I understand that I'll have the opportunity to discuss that a little bit later on in this panel discussion. So to conclude for now, COVID-19 poses a threat to the protection of human rights, atrocity prevention, and transitional justice. Some recommended immediate measures include the following. There should be stricter controls on the use of force by security forces to enforce laws aimed at containing the spread of the virus. Governments and security forces should, of course, refrain from using these laws to limit human rights and suppress dissent. And national human rights CSOs and justice mechanisms should mobilize to synergetically monitor human rights violations and investigate and prosecute offenders. Thank you.
Thank you, Angie. And yes, we'll talk a little bit later on in this hour about the comparisons between Ebola and COVID and the response. So thank you to all of the panelists for grounding our conversation in the new and not so new challenges that COVID presents for atrocity prevention and transitional justice efforts. I'd like to move now onto individual questions for the panelists on more specific examples about what states and civil society are currently doing to address these challenges. So my first question is for Leonore. The 2018 establishment of El Salvador's National Commission for the Search of Disappeared Persons during the armed conflict in El Salvador was in large part the result of the tireless work of families of the victims of forced disappearance, as well as many civil society organizations in El Salvador. As a commissioner, how can institutions and organizations working with families of the disappeared ensure that they continue putting families at the center of this process despite the restrictions and challenges that COVID presents?
Thank you, Sarah. The search of the disappeared should not be suspended, right? But that in practice, that is a challenge because all state institutions and also civil society groups, including family members of the disappeared, have been dealing with the pandemic, trying to be safe, and also trying to understand all the government emergency legislation, which has been really very confused in El Salvador these days. So the challenge is to also to show to the public opinion in general, that the search of the disappeared is a priority in all times, and that even though we are with this health issue that is like in the main agenda in El Salvador, family members of the disappeared should not be forget. What have we been doing as CONABÚSQUEDA? CONABÚSQUEDA is an autonomous body, but it's part of the executive branch. So first, we took our responsibility for the health and safety of the staff, and also of the communities that we work with and the family members. So we try to follow and to take all the necessary precautions to slow the spread of the virus. And all the staff members of CONABÚSQUEDA continue working from their homes, trying to make the best of the use of technology available, to remain in contact with the civil society groups and also with family members. We definitely suspended all the field work. We have postponed meetings, conferences, workshops, and we have concentrated in all the desk research, all the work that we can do to keep the search alive, but that doesn't imply field work, like going through databases and many other tasks. So these are challenging times, and we are proactively adjusting and revising all our work plans to ensure that we are able to continue advancing our mission and supporting transitional justice processes, as I said, prioritizing desk research, desk work, and also trying to help families with the additional trauma that this time has put on them, and also trying to fill different needs. We had an internal discussion and came with the consensus that some activities, in the case of family members, cannot and should not be conducted online, right? Because some of the main, the main purpose and the main focus of many of the activities that imply the search of the disappeared are intended to promote more participation and present and active participation of family members. And most of them do not have access nor knowledge of virtual means. So some of the things will have to wait, but definitely we haven't suspended the search of the disappeared. And one last thought is that as Conabúsqueda, we're also trying to contribute to the narrative of the importance of paying attention to guarantees of non-repetition, because we're seeing, as I said before, it's very dangerous authoritarian trends in the government of El Salvador right now, and we've seen like the harm that this kind of government actions can inflict in people. So we're also trying to be very strong in saying that we need to pay attention to not to go back to past authoritarian measures and the importance of non-repetition. The peace accords signed in El Salvador in 1992 should still be like a nation and a country accord that should still now lead the democratic life of El Salvador.
Thanks so much for that perspective, Leonor. And you mentioned, I think at the beginning of your response, emergency legislation. And if we have time at the end, I know we have one question about such legislation and ensuring it's promptly revised. So hopefully we can get to that later. My next question is for Onyango. Survivors of conflict are already a vulnerable group who can face challenges accessing their rights in normal times. What are some strategies in Uganda and elsewhere to ensure that survivors' rights, access to services, and struggles for justice are not further marginalized during this time?
Thank you. So, although, of course, COVID has been a very negative factor in the sense of which I have already spoken about, there have been some positive developments, like a rethinking about how civil society interacts with survivors of conflict and those whose human rights abuses have been violated. So, for example, among civil society organizations is an increase in use of technology to reach survivors of conflicts and those whose rights have been violated. So there is an increased use of technology in Uganda to track some cases of rights violations, but also to keep in touch with program affected persons. There is also very innovative ways of maintaining contact. For example, a number of NGOs have focal point persons down the grassroots who report and keep in touch with survivors of conflict. But on the whole, we hope that the use of technology by civil society continues to increase, and that survivors are kept in touch with organizations that render justice services even after COVID.
Thank you, Onyango. And yes, thank you for connecting this to technology and rights violations. Maybe we'll have a question about that coming up. So my next question is for Anji. With the spread of COVID-19, in many regions, there has been an associated rise in prejudice, hate speech, and violence against groups who are perceived to be the other, or perceived to be carriers of the virus, as well as against minorities who are already facing discrimination as the other. But West Africa's previous experience with Ebola may indicate that COVID survivors could also face ongoing discrimination even once the pandemic is under control. For example, in August 2014, a survey conducted by UNICEF in Sierra Leone reported that 94% of respondents held negative attitudes towards survivors of Ebola. Based on your past experience at the Media Foundation for West Africa during the 2014-2015 Ebola outbreak, what can states and civil society do now and in the coming months to ensure that COVID survivors, particularly those in fragile states, are not further stigmatized by the virus of prejudice?
Thank you very much for the question, and it interestingly provides me an opportunity to reflect on past life at the Media Foundation for West Africa. In 2014, I monitored and remotely investigated the impact of the Ebola outbreak on freedom of expression specifically, including overbroad restrictions, curfews, and censorship, sometimes violently implemented, to prevent the spread of information about government corruption and mishandling of the Ebola epidemic. The media back then, as we have seen today, can also play a dangerous role in spreading misinformation and harmful rumors. And to combat that, Media Foundation conducted sensitization programs for journalists on how to effectively report on Ebola without stigmatizing infected individuals or health workers. The need to sensitize communities about the role of health workers at that time was underscored when a mob in Guinea killed an Ebola sensitization team of 3 journalists and 5 health workers due to fears that the government was deliberately spreading the disease through health workers. Unfortunately, one of the recent COVID-related attacks in Guinea did also include an attack on a nurse, only this time it seemed to be because of her political beliefs and not for her affiliation as a health worker. And while health workers fighting COVID have been attacked in different parts of the world, it does not appear to be as egregious in West Africa as it was 6 or 7 years ago. The issue of preventing, or at least mitigating, prejudice against infected individuals remains relevant today. COVID is already exacerbating the vulnerabilities of marginalized groups. Women, in particular, confront economic and health-related challenges, as well as gender-based violence during the pandemic. This is similar to Leonore's comment about the situation in El Salvador for gender-based violence. The UN Secretary General and the African Commission on Human and People's Rights have urged the inclusion of the prevention of violence against women as a key part of COVID response and recovery plans. And it's worth noting that women were also more vulnerable to Ebola and the attached stigmatization due to the traditional gender roles played by them in caretaking, performing funeral rites, and cross-border trading. Today, people suspected of having contracted COVID-19, like Ebola survivors, have said they are treated like pariahs. They're singled out at work, in their neighborhoods, and even in their homes. Across West Africa, the stigma attached to the coronavirus has caused some patients to avoid seeking treatment just so they do not become ostracized. In Cameroon, Gabon, and Senegal, evictions of tenants and isolation from work have also been reported by those who've recovered from COVID. So what can we, civil society, and also states do to prevent the stigmatization of COVID survivors? In 2014, Media Foundation found that community-based radio in traditional languages and the involvement of traditional and religious leaders contributed to reducing stigmatization during the Ebola outbreak. I believe that sensitization programs, which could be held in partnership between trusted civil society interlocutors and government actors, as well as education initiatives, will continue to play a key role in combating stigmatization and stereotypes of COVID survivors, just as it does in combating other forms of discrimination. Involving communities and leaders, and not just those in the capital, is crucial to this effort. Governments in general should balance the need to enforce strict preventative measures while preventing the fearfulness that often leads to stigmatization. For example, in Ghana, the government put in place a team of psychologists to help those infected and educate the public in order to combat discrimination faced by current and recovered patients. In Nigeria, public health announcements have emphasized that stigmatizing survivors is wrong and that coronavirus, quote, is not a death sentence, end quote. And in Liberia, one of the formerly Ebola-affected countries, there is a discrimination helpline for those who experience or witness discrimination or bias. These are just a few examples of good practices that other governments can and should follow. To conclude, there are certainly lessons on the continent, from Ebola or to Lassa fever, that can improve COVID-19 responses to prevent both the disease and the symptom of discrimination that often follows. Thank you again for the opportunity to share these insights.
Thank you so much, Anji. And I'll go right to my last question for Mo, so we can make sure that we have enough time to answer some of these great questions that are coming in. So Mo, I wanted to ask you about bringing all these experiences together as we think about preparing for possible future global health emergencies. What lessons can we learn to ensure that transitional justice and atrocity prevention efforts in future are not as affected by similar events?
Thank you very much for your question. I was fascinated by what I heard from my colleagues just before, and they have given many examples during the question. So I will try to continue the reflection and share both examples and questions for ourselves as a community. So what I have observed is many touchy processes, difficult processes that need constant negotiation still among parties. In particular, delicate processes which deal with very difficult issues of transitional justice precisely, or prevention of certain atrocities, are extremely sensitive. And therefore, these processes are very vulnerable to this kind of situation, to this kind of pandemic. They may be blocked under the pretext of confinement, people might be repressed, or their confidentiality violated. So we have to find solutions for that. And they are very practical, and we have heard some of the solution to avoid such processes to be so suddenly stopped, blocked, or even postponed forever. On another note, what we have been hearing is that this ongoing conflict, while a pandemic is taking place of this kind, generate new violations and atrocities that remain in this time of pandemic not timely addressed, such as new waves of massive and forced internal displacement. For example, Cameroon now, NGA has been talking about Cameroon. Cameroon is one of the countries now where you have massive displacement. The situation in Yemen is absolutely catastrophic. And the pandemic information is taking the first place in that, and are sometimes making it difficult to follow this situation carefully. Another factor is also that new systematic violations of economic, social, and cultural rights, in particular against indigenous peoples, are rising in all contexts that I know. And we have very few information about that. I can speak about indigenous people in Brazil, also in Colombia, in Philippines, and in other contexts. Another point is, in certain regions during these pandemics, armed actor, non-state armed actor, many times, including mafia groups and criminal groups, have been controlling the entrance and exit of villages, controlling what enters, what can come out. And this is actually a step towards militarization of this region. And that's very, very concerning. So in a nutshell, I would like to say that in processes where negotiations are still needed among partners, or where there are still deep disagreement, I have observed that these processes are either on hold, blocked, or in some cases, spoilers may have largely abused social media to try to jeopardize these processes. In the Philippines, to give an example, while we can note with a remarkable work realized by the new Ministry of Social Affairs of Bangsamoro, under the leadership of Minister Raissa Jajure, a remarkable work has been done by this very young government to reach out to the most remote communities. And one of the problems was to reach out to all the communities, including the minorities, and they have done that. And that has raised huge hope among the population. I still have time. But on the other hand, regarding the Bangsamoro peace process in particular, the implementation of the transitional justice measures upon which both parties, government and MILF, have taken decisions, to my information, the implementation is somehow on hold. And parties don't meet to discuss about that. In Colombia, the institutions in charge of transitional justice work in very, very, very difficult conditions. Some conditions are the normal, usual, but they are all somehow exaggerated by the phenomenon of the pandemic. The Truth Commission, for example, cannot meet with victims in safe spaces as long as confinement is obligatory, which makes it very difficult to take testimonies for very confidential issue. While on the other hand, the Regional Truth Commission in the Pacific region has been very instrumental. It's in the region, And it has used this moment to strengthen what I would call a togetherness with the community and continue at a micro level their work with the communities. So you see there, they have been very resilient to adapt their work, and they continue. Another institution in Colombia, the Special Jurisdiction for Peace, continues to be affected by heavy attacks stemming notably from the governmental party. This is not new. But it creates, because there is a massive use of social medias, extremely hard pressure, while the Commission on Missing faces very difficult concrete obstacles precisely in this pandemic context. And you will understand this for many, many reasons in the context of massive number of deaths. So another positive note, and I will end with that. I had the honor, for example, to be asked to give advice to the preparatory committee for the Truth Commission for Kosovo, who are finalizing their law. And in this context, what I have observed is that all preparatory work can be even more easily be realized. I believe that these kind of processes, brainstorming, have been more inclusive, more horizontal. Equally, I've seen this in the regional initiatives of GAMAC, where before we felt if people cannot come physically, they will feel like, you know, we can't really talk. But actually what I have observed is that thanks to IT tools, and because we had finally to do it, we have been, I think, more inclusive, more participative, and people who could never travel to attend a meeting have been sharing their idea, participating, and contributing a lot to during many meetings. And I had more and more numerous meetings during this period. And I think that for these issues, especially which are very touchy and for which we should not lose too much time. We have time, but we don't have time. There is a feeling of urgency, especially in giving appropriate answers to the victim or avoiding in the field of prevention a difficult issue. And at last, but not least, I have seen in this context and in different countries very interesting new approaches with art and memory, where communities could also easily and more easily use their simple tools they have at home, share it on the internet, and therefore I think there is a kind of interesting challenge of basically decentralization, which could be a huge asset for transitional justice and prevention, and also multiple ways of communication that could also be very interesting and strengthening horizontality, diversity, which is key for transitional justice and for prevention. So I hope I have answered. Thank you very much.
Yes, thank you so much, Mo. And thank you to everyone. We've had a lot of great questions coming in, especially over the last 10 minutes or so. We only have a few minutes left, but it seems that a lot of these questions are kind of circling around the same point of where do we go from here, and what can civil society do to ensure that their governments are not using this opportunity to divert from agreed transitional justice plans. One person asked specifically about the AU-TJ policy that Anji mentioned. We have another question specifically about the situation in Bangladesh, the Bangladeshi government not providing rights and assistance to vulnerable people. I was just wondering, since we only have a few minutes left, I would just perhaps open this up to any one of the panelists that wants to answer about next steps and how to keep governments and TJ institutions on track.
I can start if no one else wants
Great.
to go. I think that civil society, as always, plays an invaluable role in its ability to mobilize and to keep certain items on the government's agenda, obviously depending on the country that somebody lives in and the situation of perhaps entrenched impunity. Those things are all factors that come into play. And in those cases, if it's possible to say, keep this on the radar of major donor states, that peer states that can influence your own government in the instance that you're unable to do so yourself for whatever reason. I think that these are still things that can happen. I think that like Mo said, the opportunity to have engagements with various actors has really increase, like your ability to be somewhere, assuming you have the infrastructure, the internet infrastructure, but to be somewhere else in the world and then have a meeting with a stakeholder in Europe. These things happen, and we've seen this happen with various greater participation virtual meetings, for instance, with the ICC, which is one of the other programs that I work on. These are all opportunities that exist, and it makes it easier, I think, also to even schedule meetings. You used to never be able to just, call up an embassy or another policymaker and say, I want to have a virtual meeting. They would have never agreed to that, but now they've all been forced to. We're living in this new normal. So that would be my very basic broad suggestion of where we go from here as far as civil society pressure goes.
Yeah, thank you, Anji. And actually, it's interesting that you bring up like the opportunities that video meetings, for example, can bring on the one hand, and kind of the inverse of that. We also have a question from someone who mentioned how Onyango brought up how preparatory work can be undertaken at times of the pandemic to be more inclusive because of technology. But won't that kind of outreach and inclusive work be difficult in countries and other contexts where internet connectivity is actually an issue? Sure. And I don't know if Onyango, maybe if you want to first speak to that. Sorry, Anji.
Okay, so of course there are very many areas in Africa and Uganda where internet connectivity is still a problem, but there is also a very high increase in use of smartphones and internet penetration in Uganda and all over Africa. This presents a great opportunity for civil society to quickly adopt and sustainably use technology to record violations, to record atrocities that are happening, and to preserve them and use them in court at some point. So although there is that weakness, there is also a very great opportunity.
Thank you. And Mo, did you want to speak to one of those points as well, to close this?
Yeah, exactly. I find it really interesting. We are pretty much on the same line. To also, as I'm talking with people who are very far away and have difficulties, and Philippines is, for example, a good example for that, we have also found solutions. Portable Wi-Fi's and things like that are appearing everywhere now, slowly. And I have seen even that an international NGO is trying to widespread this kind of tools to enable communication. So as my colleague was saying before, I think let's remain aware of the facilities that are used that allow generally more easy connection. And now a lot of new tools are existing. So that's very technical and very practical. But I didn't know about that before, and now we are beginning to use them. So we are also very resilient as a community. So that's one thing. The second thing is, I think it's very important to make a lot of trainings about the use of tools that my colleague before was talking about, and you are absolutely right. There are programs. We can use the phones, etc. But we have to be trained in order to take informations about violations. That's very important. And so this is a good time to do that. So I have also seen in different places people who are putting their manuals or things like that in a IT form so that it can be widespread. And I think this is also boosting our capacities and intentions to realize more and more webinars or virtual trainings. This kind of follow-up that Salma Yusuf is talking about to deal with the new waves of violation and in particular making sure that we are documenting can be done. We can make training, we, the global community, can make trainings, so it's very important to do it so that at the lower, far away level, it can be done immediately. Now, I would like to make just a commentary. Salma Yusuf is writing and not diverting already agreed transitional justice plans and program. I do understand this sentence, but I would put a caveat here. I mean, we are not here to realize, I think that we have to adapt, and pandemic has shown us that we need a lot of capacity of flexibility, creativity to resonate and be able to act politically in the reality. Therefore, I think that what I've seen, for example, with this Truth Commission in Pacific has raised my attention, because they were capable in this pandemic to reorganize all their ways of working in order to use this moment, but also to put attention and to act against several new violations that have been taking place. So I think this is a huge challenge. And we cannot, I think, act as bureaucrats and say, okay, no, I have my plan. I have to, while I understand the question, I think we have to explore with our communities, with our colleagues, our own capacity to be able to react to existing realities and processes which need to be taken care now, while we are working either on transitional justice or either on prevention, even in other fields, but this needs to be taken care now. Voilà, that was what I wanted to share.
Thank you so much, Mo. That's a great way to end. And it's clear from all the questions and comments still coming in, this could have been a much longer webinar. So thank you everyone for your time. We just wanted to say briefly before you go, number one, we have a couple of, ICSC has a couple more webinars coming up. If you're interested, you can find more information on our website. We would love for you to continue the conversation by following ICSC, GAMAC, and the GIJTR on social media. And lastly, you'll receive a survey in your email after this webinar. We would love to hear your feedback. If you wanted to follow up about any of the questions or topics that we've discussed today, we would love to hear from you. So thank you so much again for our panelists. This was a wonderful conversation, and thank you to everyone who joined us.